Hello my dear friends, Clarissa Patterson here. I have another video for you girls, and this video is going to be about how does low bone density affects facial structure. Low bone density can affect facial structure, sunken cheeks, less defined jaw area, sagging, and increased wrinkles as the underlying bone support diminishes. This loss of bone density, especially in the jaw area, can make the face look older and cause the mouth to look like it is collapsing backward. The bottom line is when the bone loses mass, facial collapse will take place. So the area that will get more affected will be your cheek area and the jaw area. You will lose the definition in your jaw area. And so it's very important to go to a doctor and check your bone density, because if you're losing bone density, other things are going to occur in your body that is going to affect your health. So the increase of risk of fractures will occur when the bone density diminishes. Low bone density can lead to weakened bones, making fractures more likely, especially in older adults. What is the difference between osteopenia versus osteoporosis? Osteopenia is an early sign of osteoporosis. Their names sound so similar because they are closely related. Osteopenia is the medical definition for having reduced bone density. Osteopenia is the warning sign that means you have an increased osteoporosis and fracture risk. If it's not treated, osteopenia can become osteoporosis. Osteoporosis silently weakens your bones. People with osteoporosis are much more likely to break a bone, especially from falls. If you have osteoporosis, even a minor slip that may not normally cause injuries can lead to fractures. As I emphasized in other videos, and I'm going to emphasize again, physical activity is a must, because if you don't work out, if you don't do your facial workouts and your body workouts, you're most likely to develop osteopenia. Like we said a few minutes ago, osteopenia becomes osteoporosis. Physical activity is very, very important. You need the circulation and oxygenation in your body to bring all those good nutrients from your own blood to feed the cells and your whole body. Circulation, it is the main factor of maintaining your body healthy and youthful. And so I recommend, it's very important that as you're getting older, including myself, every single year go to a doctor and request a test of your bone density. So that way you have an idea the levels of your bone every single year. If you notice that it's going down, you need to take action by taking the nutrients necessary to prevent more bone loss in your body. So girls, I will put the photos of the nutrients that I'm recommending for preventing bone density, low bone density. So I'm going to mention again. So I recommend the calcium hydroxyapatite and the vitamin D, the magnesium glycinate. The magnesium glycinate comes in powder, and it has the GABA, which I forgot to mention, L-GABA, which is a neurotransmitter that will help to relax and sleep at night. So take it at nighttime, the glycinate, magnesium glycinate, as well the calcium hydroxyapatite at nighttime, so you can sleep good, and that way your body will regenerate and rejuvenate. And the vitamin K, also I'm recommending the vitamin K, and this particular brand is formulated with coconut oil for better absorption. I couldn't find the Opti zinc, but I did find the zinc picolinate, which also is very absorbable. And so I will put the photos in the clips and the video, so you can go and purchase it. You can find all these items in Amazon's. And so once again, consult your doctor before taking any type of nutrients. Osteopenia usually happens naturally as you age. Your bones are living tissue like any other part of your body. It may not seem like it, but they are constantly growing, changing, and reshaping themselves around your life. At the age of 25, you will start with a very, very minimal, gradually losing some bone. It's just like collagen. At the age of 25, the collagen start slowly degrading. And so, however, if you lose too much bone density, you can develop osteopenia, which may mean you are more likely to have osteoporosis later in life. That's why I emphasize body workouts, have activity in your body. It will help with the circulation, it give oxygenation of the body, and it will prevent the bone to degrade as well as the muscle to degrade. And so you want to look healthy, you want to look youthful, do the right thing, invest in nutrition and good nutrition that has no chemicals. I'm talking about, I'm referring to about fillers and the supplementation like magnesium esterate, dioxides, microcrystallines, maltodextrins, silicon dioxides, etc., etc. You don't want to have that in a capsule. It has to be the pure calcium. If you're going to buy the calcium hydroxyapatite, excuse me, it has to indicate just the capsule and nothing else. The capsule and of course, the calcium. And sometimes they use a very, very small percentage of organic rice powder, which that will be okay. But when it comes to chemicals, you don't want to do that because you're going to overwork your liver, you're going to overwork your whole system, your intestinal tract, and also your internal organs get affected. So I hope this video is useful for you girls, and help me promote these videos, and thumbs up for the video, and I send you a big hug. Bye bye now.